Were you told to get an eye drop over the counter and use them every day, and your dry eyes will get better? If your dry eyes are not getting any better, even though you're using an eye drop every day, this is the video for you. In today's video, I'll give you my step-by-step guide for treating dry eye disease at home. The steps are simple to follow and do not need a prescription. Most importantly, if you follow my recommendations, your eyes are going to feel more comfortable and lubricated. Hello everyone, this is Dr. Audrey Tai. I'm a board-certified and fellowship-trained refractive and cataract surgeon, ophthalmologist, and cornea specialist. Welcome back to iChannel by iSurgeon. This is the first video of my latest dry eye disease series. Make sure you subscribe to my channel and turn on the notification bell for upcoming videos on how to choose the best eye drop for your dry eyes and how eyelid inflammation is making your dry eyes worse, and many other topics on eye health. Step 1. Warm compresses. This is the first step in the morning and the last step you should do before bed to treat your dry eyes. Our tear film has 3 layers: the lipid or oil layer, the aqueous or liquid layer, and the mucin layer. If your eyes feel dry and irritated shortly after applying over-the-counter eye drops, or you feel like you need to put in your eye drops over and over again, there's likely a deficiency in the lipid layer of the tear film. Our eyes need this thin layer of oil to hold in the tear moisture. This is why we need to address the oil layer of our tear film before just putting in more eye drops. This thin layer of oil is secreted by the meibomian glands located in both upper and lower eyelids. If the meibomian glands are clogged, for example, by cosmetics like eye makeup, or irritated by contact lenses, our tears may lose the protective oil layer. Less oil means more moisture evaporates, and you guessed it, our eyes get dry. So we really need to get the meibomian glands unclogged to get the healthy oil into our eyes. Applying heat directly to our eyelids helps melt the thick meibomian oil into liquid and unclog the meibomian glands to restore the flow of oil into our tears, to help our eyes retain moisture for much longer. If you're already doing warm compresses at home, but have not found it to be very effective, you may not be doing them correctly. The key to getting the benefit of warm compresses is to apply consistent heat to our eyelids at the target temperature for 5 to 10 minutes continuously. Studies have shown that the optimal temperature for 90% of the meibomian oil to melt into its liquid form is between 40 to 41.5 degrees Celsius, or 104 to 106.7 degrees Fahrenheit. Using a washcloth soaked with hot water often cannot provide sustained heat at this target temperature. You need to rewarm the washcloth many times. Eye masks specifically designed to use on closed eyelids can offer more consistent and longer lasting heat to the meibomian glands to help release oil from the glands into the tear film. In my clinical practice, I recommend Optase Moist Heat Mask to all of my dry eye patients. The Optase eye mask provides moist heat by using the hydro-bead technology, which absorbs and stores moisture from the air while releasing consistent heat for over 10 minutes. You can heat up the Optase eye mask in an 800-watt microwave for 25 seconds. Make sure you follow microwave wattage instructions as they may vary. Place the heated eye mask over a piece of clean tissue to keep the eye mask clean, and place the eye mask over closed eyelids for about 5 to 10 minutes for each session. I recommend my patients to do 2 sessions of warm compresses, morning and night, for 5 to 10 minutes each time, using the Optase eye mask. I've listed links for all of the products I mentioned in this video below in the description of this video. You can check them out. This video is sponsored by Optase, which is a brand I have recommended for quite a while to my patients in my own clinical practice. So I'm happy to now be able to partner with them to bring you this educational video series on dry eyes and blepharitis. If you stay with me until the end of this video, I will go over the single most important component of any dry eye treatment. Step 2. Preservative-free artificial tears. You may be thinking, I have been using over-the-counter dry eye drops many times a day, but my eyes are still dry and irritated. Then my question to you, well, which eye drop are you using? And how many times a day are you using them? Using the right type of over-the-counter dry eye drops will help restore the moisture in our eyes, but using the wrong ones can cause damage to the surface of the eye. A good dry eye drop can help replenish the moisture in our eyes, and it is long-lasting, without blurring our vision for long periods of time after applying the drop. Also, it should not contain any toxic ingredients that can be harmful to our eyes during long-term use. it is very important to use eye drops that are free of preservatives whenever possible, especially if you wear contact lenses, because there are special cells on the surface of the eyes called goblet cells. These special cells create the mucin layer of the tear film, and they can be damaged when exposed to excessive amounts of preservatives in eye drops over a long period of time. When the mucin layer of the tear film is damaged, the moisture in our eyes will not evenly spread across our cornea, the clear windshield of our eyes, and our eyes start to get dry patches. The artificial tear eye drop I recommend for my patients is Optase Dry Eye Intense Drops. It is preservative-free and it comes in a multi-dose bottle. Once opened, it is good to use for 3 months if stored properly. The active ingredient in Optase Dry Eye Intense Drops is 0.2% glycerin. Glycerin has 3 functions: demulcent, lubricant, as well as a humectant. This means glycerin can reduce inflammation and irritation in our eyes, lubricate the surface of the eye, and help our eyes retain moisture. Glycerin can also promote surface cell growth in our eyes, the epithelial cells, and reduce the osmolarity or thickness of the tears to help spread the tears over the surface of our eyes. Optase Dry Eye Intense Drops also contain sodium hyaluronate. Sodium hyaluronate is a derivative of hyaluronic acid, and it is also a triple action ingredient. It is a humectant, lubricant, and it is hypoosmotic, meaning it can reduce the tear thickness. It is found naturally in the eye, where it is produced as the response to injury to the surface of our eyes to promote healing. Sodium hyaluronate can also reduce mucus strands in our tears. I have found that Optase Dry Intense Drops can provide a long-lasting moisturizing effect, and it does not cause prolonged blurry vision compared to some other eye drops intended to be long-lasting. I recommend my patients to use Optase Dry Intense Drops 3 to 4 times a day throughout the day on a regular basis. And they can use it more often if they have severe dry eyes. You do not need to use more than 1 drop each time, as only 1/20th of an eye drop will stay in our eyes, and the rest either runs out the corner of our eyes or drains into the nose through our tear duct. If you're experiencing dry eyes after eye surgeries, such as LASIK surgery, or have other medical conditions such as Sjogren's disease, seasonal allergies, stay tuned for this video to learn more about my recommendations of dry eye drops for those special cases. You can also check out my video here about dry eye drop ingredients if you want to learn more about this topic. Step 3. Omega-3 oil supplements. This step also addresses the lipid layer of our tear film. It specifically treats dry eyes caused by meibomian gland dysfunction. When the meibomian glands are not working properly due to inflammation or clogging, or if the meibomian oil is too thick or has abnormal composition, the lipid layer of the tear film may either contain too little oil or poor quality of oil, and the moisture evaporates very fast in our eyes and result in dry eyes. Meibomian gland dysfunction is typically caused by increased inflammatory particles in the tear film. In this case, it is important to modulate and restore the health of the meibomian glands and their oil. This is where omega-3 supplements can come into play. Numerous studies have shown that omega-3 oil supplement can decrease inflammation of the meibomian glands, improving meibomian oil flow into the tear film, as well as improving the quality of the meibomian oil and improving dry eye condition. Because omega-3 supplements are not a prescription medication and are not regulated by the FDA, their dosage and composition may vary greatly. When you are picking an omega-3 oil supplement, you need to pay close attention to the amount of omega-3 fatty acids and specifically the amount of EPA and DHA contained in the product. You can check out this video where I take a more in-depth look into omega-3 oil supplements for dry eye disease. I recommend both the Nordic Natural and PRM brand of omega-3 supplements, as they contain adequate amounts of EPA and DHA that are in the triglyceride form. I put the link in the description below for the 2 brands of omega-3 oil for dry eyes if you would like to check them out. High-dose omega-3 oil supplement is not for everyone. Please remember to always consult with your doctor before taking any high-dose omega-3 supplements to make sure that they're safe and right for you. In this video, I gave you 3 easy-to-follow steps that you can do at home to treat your dry eye condition. There are also other more invasive and advanced treatment options that require prescriptions and are typically reserved for more severe dry eye cases. To learn more about those treatment options, you can check out this video. What to do when eye drops are just not enough. It is important to remember there's no one-size-fits-all treatment protocol for everyone. In my clinical practice, I prescribe an individualized treatment protocol for each patient based on their individual situation, and I tailor their treatment plan based on their response to each treatment. For most of my patients, their treatment plans include these 3 steps. If you would like to schedule an individual consultation with me, you can contact my office to schedule an appointment. You can also follow me on Facebook and LinkedIn at Dr. Audrey Tai to learn more about my practice. Thank you for staying with me until the end of this video. As I promised at the beginning of the video, I would like to share with you the single most important component of any dry eye treatment. The most important thing you can do to ensure that your dry eye treatment is effective is to be consistent. If you only apply eye drops or do dry eye treatments when you're experiencing symptoms, such as redness, soreness, or irritation, the treatment effect will not be long-lasting. When you adopt any or all of the 3 steps and do them consistently on a daily basis, the treatments will act as preventative measures to help prevent you from getting dry eye symptoms. If you feel your eyes are still irritated or sometimes have blurry vision, despite using over-the-counter eye drops and other at-home treatment I mentioned in this video, it is important to have a full eye exam and talk to your eye doctor about what other treatment options might be right for you. Let me know in the comments below which dry eye treatment step I mentioned in this video you find most informative. I hope you find this video helpful. If you have learned anything new from this video, please don't forget to hit the like button and subscribe to my channel to help me bring you more videos about eye health and eye surgery. Thank you again for watching, and I will see you in my next video.